And Anj, we saw record numbers in pediatric cases out of Florida over the weekend. What does this tell us just about what we could expect going forward?
Well, this really sets a concerning tone, as we know that, a lot of individuals are watching the trend line for kids and cases specifically with kids as we talk about the start of the new school year. Florida setting the tone for that, as well as other states when it comes to generally and broadly cases and the rise there. We know we've been watching Florida as it became the new epicenter of the pandemic in the recent weeks, and now Texas as well. And the one thing that these two states have in common is that they've decided to really restrict any mandates or any sort of strategies that would help curb the transmission. Florida specifically saying that it would penalize school districts that choose to implement any sort of mandates or other physical distancing restrictions. And that is setting a really concerning tone. Health experts are very concerned about what this means, what the count will then end up being, because as we know, children remain unvaccinated largely, especially in the school age group. So that's something that will be interesting to watch as the days come closer when it comes to the start of the school year.
All right, Anjali Kamlani, thanks so much. We want to continue this conversation, talk about what we could expect really going forward in this school year. We have Dr. Sarah Moran-Bodie of the American Academy of Pediatrics Council on School Health. Also, our education reporter, Arti Swaminathan, is joining the conversation. Dr. Bodie, from your perspective, I think so many parents who are getting ready to send their kids back to school over the next couple of weeks are very confused. They don't know what's safe and what's unsafe at this point, just in terms of what they should be doing to best protect their children. So what's your advice?
Yeah, great question. Thank you. One of the things we know is that first we want to prioritize getting kids back into school. It was really challenging for kids to have online learning last year. It was not ideal for academics, for social emotional learning. The other thing we know is that when kids did go back to in-person school and schools used those safety measures, they worked. So when kids all wear masks, and that's universal, with the hand washing, good ventilation, we can get kids back into school and have it be safe. So as a parent, I think it is really important to understand what is your school district planning to do to help promote those safety precautions, and what are they putting in place to keep your child safe from COVID?
Doctor, we've seen a lot of cases of children contracting COVID, right? So what do we know about the Delta variant? How is it different? And why was the first instance of COVID not as impactful as the variant, right? Lots of questions. So can you help us a little bit about that?
Yes, absolutely. So the Delta variant, has been the predominant variant that we've seen recently. And as COVID has progressed, we've learned a lot over time. And what we know is just like in adults and kids, this Delta variant is just more infectious. So meaning it's easier to pass from child to child or child to parent and adult. And so it's concerning to us if we're having kids back in school without any of those other protections in place. We also know that as many of our older adults got vaccinated, and that vaccine rate is high, our kids aren't vaccinated. So as we're seeing COVID trend, we're seeing more cases in kids. A higher percentage of everyone with COVID is young adults and kids now. And so this is a concerning trend we want to watch and make sure we're protecting our kids until they can get vaccinated.